Okay, this is a practice for injections 2. So we've already done, had an introduction to regular IM injections. I want to talk about doing a Z-Track injection. For Z-Track, you will prepare your syringe as you did for any other injections. The reason we're doing a Z-Track is because some medications are very irritating to the skin, and we don't want it to leak out onto the skin. One medication I can think of is Vistaril. And when you give an IM injection of Vistaril, you can expect your patient to react. It burns, it hurts, and certainly as I'm preparing it, I want to be cautious not to get any of the medication on the length of my needle. We've already gone through, how we draw up the medication. We get the fluid level up to the hub. And then once we have no air, then we want to lay it down with the bevel down and then push the rest of the air out that was in the hub and the length of the needle. We want to push that air out till we get medication right at the tip and then click it till it drops off. So we have our needle prepared. Precautions then that we'll take at the bedside is to, first of all, cleanse the skin. And I honestly should have this recapped at this time as if I were just coming to the bedside. So I'm going to cleanse the skin in a circular motion, going inner to outer. Then what I want to do then is displace the skin so that I've moved the subcu tissue to the side, just with the heel of my hand. I'm not setting it on the area that I have already cleansed. So basically I put my hand down and then move my hand. And you can kind of try this like on your leg, like if you've got shorts on, put your hand down on your leg and then move it to the side, and you can see how the tissue displaces. So once I've done that, then I will pull my skin taut, and again a dart-like motion, a little bit of wrist action in there, inject, stabilize, aspirate, inject slowly, and then once I'm in, I'm going to hold it for 10 seconds, allowing that medication, the muscle to relax and that medication to begin to absorb, and then I'm going to pull it out, and as I pull it out, then I'm going to remove my hand and allow that skin to slide back over and cover the injection site. I'm kind of a visual person. I like this, so I have pulled my skin to the side and I've injected, so you can see where the medication goes down and is injected deep into the muscle. Once I pull my hand away, that allows this top layer to slide back over and then seals that medication down in there. So there's a picture of this in your book that's real good. So like I said, I'm kind of a visual person, and to me that was helpful. All right, from there we will go to sub-Q. For a sub-Q injection, you want about a 1 milliliter syringe. Generally you're going to have around a 5/8, or if you think about a 1/2 inch needle, around 25 gauge for preparation. This goes into the subcutaneous tissue, not down into the muscle. So we know that the sub-Q tissue is less vascular, and therefore we don't need to aspirate. For preparation, I have drawn up my medication. I have it prepared. I'm at the bedside. I have some choices when I'm going to give a sub-Q. On an average person to a thin person, I can inject at a 45-degree angle. If I have an obese person, I can use a 90-degree angle. Again, my concern is making sure that I'm in the sub-Q tissue and not going through to the muscle. So my thoughts are, if you have any question whether you should use that 90, if the person's heavy enough to use a 90, if you have a question, just go ahead and do a 45. Other choices is to pinch the skin up before you inject or not. Some of the thinking is that pinching can cause tissue trauma, so you want to be aware of that, and the times you do choose to pinch, you want to be cautious and not to traumatize the skin. Well, let's say, and then in many cases, like say if I'm giving a sub-Q injection into the abdomen and there's no bony structure underneath of there, then I often then will pinch, because it's a little difficult to give the injection without having that pinch. And the pinch is said also to somewhat desensitize so that the injection isn't quite so painful. Another case where I will choose to pinch is, like say if I'm giving an injection to an elderly person in the back of their arm, and maybe they carried more weight as a younger person and now they've lost it and their skin is really loose. Sometimes you just need to really kind of pinch it in order to do the injection. So again, I am going to cleanse the skin, inner to outer, and I'm going to allow it to air dry. And let's say I'm going to pinch. I pinch up the skin. I hold my syringe like a dart, and I have the bevel up. I want to always make sure the bevel is pointing up with a sub-Q injection. Again, a little bit of wrist action, and like a dart, and I inject, stabilize, and inject. Pull out and cover. Okay. If I were doing it at a 90-degree angle with no pinch, I would then simply pull the skin taut and inject, stabilize, and inject. Pull out and cover. All right.